Prize, one of the thing that I'm really looking forward to is over time then we will have a collection of different examples of like how people have utilized GBD evidence to change policy. It will turn into this knowledge exchange platform where countries, researcher, policymaker from one country can look at the other country and see how others are using it and how like they were used to address what burden of disease, and so I'm actually looking forward to like the accumulation of examples where it turned into a knowledge sharing platform. In the recent research on smoking prevalence that I've worked on, it is very striking. So we see progress made in a number of countries. However, in general, like the total number of smokers are still increasing over time from 1980 to 2012, where now we have like 967 million smokers, which is still alarming considering that smoking has proven to be related to so many types of disease. And I think like just linking it back to what we've learned in previous global burden of disease exercise, we are seeing a shift in the burden in many countries from infectious disease now to non-communicable disease. China is a classic example where actually over 50% of the men are current smokers. And we are also seeing like there's increased burden in non-communicable disease. And so this is alarming that something has to be done. And we are seeing China kind of escalating the tobacco control policy, that there are a lot of trials going on to experiment the effectiveness of different interventions in different provinces. So I think it will be crucial to continue monitoring how effective these interventions are in reducing the exposure to smoking and hence the disease burden related to smoking. So it is very exciting to know that GBD is ongoing. One thing is that means we can keep improving our estimates because every year we'll have new data coming in, and we are very aware that there are some limitations in our analysis. So the ongoing GBD means that we can keep absorbing new information that's coming to improve our estimate and to be as accurate as we could. The second thing is now that we have a continuous GBD update, we will also be able to provide more timely information for policymakers to adjust the program. So while GBD tend to be more descriptive, I think in IHME we always were wondering where the E is. And so the continuous GBD will allow more systematic monitoring and hence eventually will lead to evaluation. There are so many programs that's like happening around the world. I think it is very critical to have a consistent metric that could be tracked and traced over time. And also policymakers really need timely information. So policy could be adjusted in certain manner that will fit the needs. And also they could identify the priority areas more effectively through a good metric.